Hello.
Hi, everyone.
So I'm Giles,
And I'm Vanessa.
and welcome to this webinar. We're going to be talking about clinical UX and COVID-19.
Yes.
So this is obviously quite a big, popular topic. We're living in a pandemic at the moment. It's causing all kinds of stresses and strains. And to that end, we actually want to just set the scene just a little bit more, just to highlight what does it mean at the moment living in a pandemic caused by COVID-19.
Yeah.
So this is the latest data that we've been able to pull from John Hopkins website, which gives us details on the latest numbers of cases, as well as the latest number of deaths and those who have recovered. So this was only taken about half an hour ago, thereabout. As you can see, there's 45, nearly 46 million people that have been infected with this virus since late last year. And we have over 1 billion people. So over 1 million people, sorry. Not as that bad, over 1 million people that have sadly though succumbed to the virus.
Yeah.
So this is quite serious. As you see, the numbers are still very, very high in the United States. And it's causing a lot of problems around the world. In particular, where my hometown is the United Kingdom, that's where I was born. And you know, it's quite bad still over there. Not so much with the number of cases, but just how this is affecting people's daily lives. You're going to find an increasing number of people who are now being locked down again. They might have to be furloughed by the amount of money that they can get paid by the government, as opposed to the employer is reducing, like it's starting to have impacts there. And it's frustrating. Let's be honest, no one really wants to be locked up in their house to stop getting this virus, especially when most people get the virus don't die. So it's not like it's killing everybody who gets it, but it's still a huge disruption to life when you get the virus. And in an effort to try and prevent its spread, this is then therefore leading to a lot of people having to stay at home. What have been your observations, Vanessa?
It's been interesting because I think for me, like you said, it is weird to feel like you're constantly in some sort of lockdown. Or have some sort of restrictions. This year we had so many plans with regards to traveling, with regards to seeing family and all those kind of things. And obviously, as you would know, a lot of them had to be scrapped. A lot of them had to be cancelled. And it's interesting that, you know, now, so we're based in Germany, and now Germany is going back into a partial lockdown as of Monday. France has already gone into lockdown as of yesterday. Belgium is going into partial lockdown as of Sunday. So this second wave that everybody kept talking about and not really saying when it's happening, they kept saying it's going to come, it's going to come. But it seems like the second wave is here now, and governments are deciding what they want to do in response to that. It's been weird for us because obviously we emigrated well, I moved back, you emigrated to Germany last year. And so it's been different for us anyway, because our social life has been slower than it would have been in the UK and all of that anyway. But now it's like, okay, so we've been here literally for a year. We've not been to the cinema as much as we would have loved to. Like, it's the little things that you just start missing quite a bit. And so the fact that our life hasn't really changed much. We're both working from home. You know, we see people when we see them, we see our neighbors, but we don't really see people out and about. So whether, for us, practically, whether we're in partial lockdown or not, doesn't make much of a difference because we're not traveling anywhere anyway. But there's still a lot that it's just mentally, I think, quite taxing.
Yeah, and we're going to go into more details about this. But just to start off, actually, it's just reflecting that people are reacting so many different ways. Because not everybody has the luxury of working from home. Not everybody even has the luxury to have a job to be fired from, let alone to lose their job. So people are reacting in very, very different ways. And Vinay is going to go into a lot more detail, actually, in some of the key ways that people are reacting differently.
Yeah. And so, for those that don't know, so I am a counselor. I'm also a coach. My business is called The Blueprint Way. And so at the start of the year, I was kind of reflecting on, well, April-ish, I was kind of reflecting on what are the psychological effects of COVID-19 on people. And I kind of identified there's about 6 distinct responses that people can show. And these are things that they can show up in one person at the same time, or one after the other, or a mix the same day. It doesn't really matter. There's movement and flow between these 6 Ds, as we call them. But yeah, we'll go deeper into them. And so yeah, the 6 Ds are feeling dissociated, feeling destructive, distressed, depressed, determined, and also feeling very much like a doer. And I'll go into them in a little bit more detail now. So the first one is, you might feel quite dissociated, thinking about COVID-19, thinking about all the other trauma that is happening in this season and that has happened this year. There may be a psychological response of dissociation, which really refers to feeling mentally and emotionally paralyzed. It's that feeling of numbness. It's the inability to make decisions. Everything feels a bit fuzzy, confusing. You might feel a bit lost, and there's a disconnect between your mind and your body. And this is because people can be so overwhelmed by the input that this crisis is bringing that just everything kind of almost shuts down. And you may feel disconnected from your body. You may feel as though the world is a bit unreal. So there's a literal fuzzy feeling. Then the destructive, that's kind of what overlaps with what we know as the fight response. In the case of trauma or attack. So it's being confrontational, it's being aggressive in nature, but the core emotion here is one of anger. And anger, when it comes to the world of psychology, is actually a sign of a goal being blocked or being frustrated. And as we've already touched on a little bit, there are many goals this year that have been blocked because of COVID-19, whether it's travel, wedding plans, new jobs, or being furloughed in the job that you have, or actually being laid off from the job that you have. So there's so many things that have been blocked, that have been delayed for us this year. And so anger is a sign of these blocked goals. So anger in itself doesn't have to be destructive, or to be very clear about that. I'm just making the point here that actually this aggression that we're talking about is fueled by anger, and that's a relevant response to the situation we're in. And we see that with reports about, unfortunately, an increase of domestic abuse situations. You know, people are sitting on top of each other. Most of them will be repeat occurrences, so things that were already happening in the background, and it's just because you're together more often that might be more frequent. But there might also be first-time cases of people committing domestic violence because of the unprecedented times that we're in. But there's violence towards others, but there's also violence towards yourself. That's another part. So seeing suicide or suicidal ideation or self-harm as a response. The next one is being distressed. And so this is kind of similar to the flight response, if you're following those responses, where your aim is to protect yourself from the trauma by fleeing from it. So with COVID-19 being a global pandemic, there's really no place we can go to flee from it physically. But mentally, the expression of that is anxiety, it's distress, it's panic, it's just, feeling trapped. And this distress expresses itself in irregular breathing, in restlessness, in sweats, in sleep disturbances, in excessive exercise, and in worrying as well. And then moving to the next D, we've got the depressed D. So depression is a very common response to trauma. And it shows itself in continuous low mood, being tearful, feeling irritable, lack of energy, disturbed sleep, things like that, not really connecting with friends, not having any interests. And these are symptoms that I guess a lot of us can be familiar with, because I think depression has become much more of a common word and common disease as such, or illness as such, in our knowledge. So we kind of know more so what the symptoms of depression are. The next one that I looked into was the determined. So this is someone who sees this crisis as an opportunity to become more productive. This is the, we got lemons, let's make lemonade out of it kind of person. It's about, having the creative juices flowing, about wanting to set goals. It's about finding the time to, now's the time to write a book, finish a business plan, take up a hobby that you've been wanting to do for so long, declutter the home, whatever it is. But this one is really much so explained by the fact that there's a lot of thinking and a lot of ideation going on, but actually not a lot of action. which distinguishes itself very much so from the last one, which is the doer, who is somebody who is an active person in this season. They are bringing the ideas that they want to see come to pass into reality. They are setting up their businesses. They are learning that language. They are renovating that home, getting into shape, whatever it is. So it seems, on the outside at least, that they're not letting the pandemic affect them too much. And yeah, so these are the 6 that I kind of identified as these are ways that people are psychologically responding to this crisis.
Mm-hmm. So I'm really glad that you've highlighted these things, because these responses are quite important in people being able to understand actually what's happening here. And in particular, when we're talking about people responding in different ways, the way I would see it from a medical point of view, clinical UX point of view, would be actually health behaviors. Now, these health behaviors can obviously be enacted by the general public, by people themselves, patients, people who actually become sick with the virus, but also the healthcare providers. So let's just look into this in a little bit more detail now. So I'm sure we can all relate to the time that you're going to go into, seeing your GP because you're not feeling too well. But we go and see the GP or family doctor or any other healthcare professional for that matter for a variety of different reasons. And I want to highlight 2 clear distinctions, is that, there's times when people are seeking a healthcare professional, and this is part of health seeking behavior, as opposed to health maintaining behavior. So let's just look at this in a little bit more detail. So health seekers are anyone who is actively pursuing health related information, products or services. It could be someone simply Googling their symptoms, talking to a pharmacist who could give them medication, or going to see your general practitioner, family doctor or specialist, like most people in this picture are doing. But this, in contrast to health maintainers, who are people who are actively engaging with health-related information, products and services. There's either existing behaviors that are examples, it could be such as someone just wanting to, see a specialist once a year as a follow-up. Say if they've got a chronic illness, you might be only, seeking out that healthcare professional because you already know that when you get sick, you should be seeking them to get, certain specific advice and guidance, or it's just to make sure that everything's fine. So it's not actually about seeking them because you have a problem that you didn't know what to do about. You're seeking them because you know that they are supposed to help you in this situation. So it's about maintaining your health. So when there's a new health problem, this will trigger health-seeking behaviors. Moving on then, it's really important to understand that having a proper understanding of health-seeking and health-maintaining behavior can improve health promotion strategies. So anything that is being done in order to, have people understand what they should be doing to keep themselves healthy, people are much more likely to be receptive to this if we respect and design and provide solutions that deal with, their variety of health-seeking and health-maintaining behaviors. An understanding of this will also lower infection rates. You'll be able to speak to people in such a way that they then become convinced or compelled to do what's necessary to keep themselves healthy. It will reduce the delay to diagnosis of any disease. It's not just a diagnosis of COVID-19, but what if someone is actually having pneumonia? What if someone is having chest pains related to a heart attack? What are they feeling generally unwell because they're going into sepsis? Now, these are a variety of diseases which may have nothing to do with COVID-19, but someone could actually be mistaken in thinking that, well, COVID-19 is what's going on, I'll just stay at home. And that could be actually a fatal mistake. Also, when you have a better understanding of health-seeking and maintaining behaviors, you'll be able to prevent COVID-19 related complications or death, because you might even be able to prevent someone getting the infection in the first place, or if they do get infected, they're given the most appropriate treatment as quickly as possible. And then finally, there's an increase in treatment compliance for any disease. So whether it's treatment for COVID-19 or treatment for aforementioned diseases or conditions, the pneumonia, heart attack, sepsis, this treatment is much more likely to be followed if we know exactly what the diagnosis is, but also if the person in question, the patient, actually knows how best to engage with this treatment, they trust it. So the general public already have a various set of health-seeking behaviors, even without there being a pandemic. And these health-seeking behaviors are often influenced by virtually everything that can make humans different. So we're talking about gender, age, ethnicity, religion, sexuality, health status, and disability. And these are, I suppose, the most common ones. But personality is very influential too, as is the media. Therefore, we need, to understand that we're going to face a variety of behaviors as a result. And these behaviors are a huge spectrum, just as alluded to in this image. Any of these people could have COVID-19 right now. Well, it's taken quite a while ago before the pandemic, so I don't think technically any of them do. But if you stay with me, anybody here who has COVID-19 or anybody here who's unwell, they're going to react in different ways to someone sitting next to, potentially. But for me as a designer, when I put my designer hat on, I can't think that I'm going to be able to design for everybody and satisfy everybody's needs. Like the best way for me to try and make sure that I can keep as many people happy with the digital products and services that I work on as a clinical UX designer, I've got to think, well, what are some of the extremes? And how can I identify the people who may have the most difficulty or most issues? And so for me, it ties into these following areas. So the first one then are going to be those who doubt. So these are people who just don't believe the pandemic is real, or at least as serious as some people say it is. Therefore, they don't adhere to social distancing. They believe that young people are virtually immune. They believe that it's okay to get the disease because most likely it won't be that serious a disease for them. Now, none of this is actually true, but if this is what they believe, if this is what they are, compelled to believe, then this is a serious problem. You have to see, how can you have someone who's filled with so much doubt actually understand the truth and appropriately seek healthcare services? Next then would be those who are filled with dread. So these are people who are so overcautious that they self-isolate, even if they are low or no risk of being infected. And they do this as a means to protect themselves and others around them. So they may even be willing to avoid going to a healthcare provider altogether, simply out of the fear that they could be making somebody else sick, which means that they can then be sick themselves at home and their sickness could kill them. And they might not do anything about it. The next area then will be those who are discriminated against. And what I mean by discriminated against is specifically along the lines that there are a variety of people who are actually dying because of the virus, and it's got nothing to do with their genetics. It's got nothing to do even with their ability to believe that the virus is real. It's simply because of their race, their gender, or anything else that can make them different, and they've been discriminated against. We'll talk about this a little bit more later, but in particular, there are times when healthcare professionals don't actually provide the right level of care to all patients, maybe because of their own biases, prejudices. They could be racist, sexist, so on and so forth, and this leads to discrimination. In fact, we do have a lot of data that highlights that people who are of African or Caribbean descent living in the United Kingdom are much more likely to die of the pandemic, of the COVID-19 virus. And we'll talk about this a little bit more later. And then finally, the deprived. Now, actually, just before that, I want to highlight some other statistics here, in fact. So here, this should show you some data about the US, and it shows that simply by being Black or Hispanic or / Latino, you are more likely to die of COVID-19. That's literally the only difference, because age is still being accounted for, but just being of a particular ethnicity is going to make you more likely to die. And then this was something that I found from Public Health England, where they've been looking at the disparities in risk and outcomes from COVID-19. And as you can see here, people from Black ethnic groups were most likely to be diagnosed. Death rates from COVID-19 were the highest among people of Black and Asian ethnic groups. And pretty much anybody who was not white was anywhere between 10 and 50% higher risk of death when compared to white British people. So it's nothing to do with sex, age, deprivation, whereabouts that they're living. It's simply down to race. And this is a serious problem. This is a consistent problem that there are health inequalities in the world tied to people's race. So just to finish off then on this particular part of the talk is the deprived. And when we're talking about deprived, it does link quite a lot to discrimination, but it's looking at people who, they don't have the means to look after themselves fully, to satisfy all of their basic health needs. And this in particular would highlight, asylum seekers or people who are homeless, don't have a fixed abode. These people are much more risk of dying because of the pandemic, because people aren't necessarily looking out for their interests. So moving on then, let's look into this a little bit more detail then from the other side of the spectrum. So not just looking so much on the patients and their health seeking, health maintaining behaviors, but now looking at the health providers. So health providers have to find ways to ensure that these, variety of different people stay healthy. You can't just say, well, if you're doubting the pandemic, you're doubting the virus, that you should just die of it. No, these are human beings that deserve to have good health. This is a foundational pillar, first pillar of clinical UX. Everybody deserves good health, so ensure that everyone has good health. Now, healthcare providers can range from individuals such as doctors, nurses, and other healthcare professionals, all the way up to governments and international health bodies such as the WHO. Now, when we think more about these health providers and some of the situations they face, one of the things I have to keep in mind is a huge problem of there being bad advice and guidance. There's been a lot of times when Dr. Fauci in the United States has had to make it really clear about the importance of wearing masks, socially distancing from people, actually staying at home to try and prevent the virus. And there can be certain people in the world who can go against his advice, who can go against science, and it's extremely destructive. It is facts that masks help, socially distancing helps to prevent the virus from spreading.
And I think just to add to that, it's also looking at the different agendas that are trying to be met, because we've got the agendas by healthcare providers and health agencies, but we also then have the agendas of economists and agendas of politicians, because even with we have the example of obviously Dr. Fauci, but we also have the example with SAGE in the UK, the Scientific Advisory Group, telling the UK that the best scientific way to deal with the disease now, as of September, was to have a lockdown. But these are the things that need to be weighed up. It's not just science that has a part to play in this. It's also economy. It's also politics, and to a certain extent, political games.
That's right. And this is the main point being highlighted here, is that healthcare providers can have the best intentions in the world. But if there are politicians and other powers at play that are against their agenda, or even worse, that they're against their agenda and have the power to overrule them, then they're in a very difficult place. Very, very difficult place. The other thing to understand about the behaviors of healthcare providers is the fact that, and I can attest to this, you're willing to do all that's necessary to look after your patient. And these are just some of the many faces of healthcare professionals who have actually given their lives in the effort of looking after people. In the United Kingdom, there's been over 650 healthcare professionals and social workers who have died because of COVID-19. And in the US, there's been at least 1,700. And these numbers are the ones that are reported. There could well be many more people that have died, giving their lives in order to protect those who are sick or dying from the pandemic. So let's just explore some ways then that we can actually encourage people to maintain good health. So there's a variety of these. The first one then is actually do what's necessary to reduce transmission. So the crucial things here is obviously wear masks, socially distance yourself, and be hygienic. And what I mean by being hygienic is the fact it's just simple hand washing techniques. If you know you're going to sneeze, sneeze into the back of your elbow. You know, actually ensure that when you're using a tissue, put it straight away into the bin. It's simple things like this. You know, try and use hand sanitizers to clean down your hands and clean certain surfaces, but also wash your hands regularly. And the reason why it's better to wash your hands is just use the hand sanitizers. So it's really bad actually using the hand sanitizers because they can dry out your hands. And unless you're being very vigorous with them, they might not get rid of all the virus on your hands. Washing your hands with soap and water, making sure that you wash for at least 30 seconds, rubbing every surface around the hands. That's the most effective way to ensure that your hands are actually clean. But wear masks, socially distance yourself. If you've been advised by a healthcare professional actually you shouldn't be wearing a mask, then that's fine. But if you can wear a mask, you should wear one and keep your distance from people. So then the next area then is looking at the fact that there is actually a lot of issues with fake news. So we need to present real facts the right way, only showing news from verified, trustworthy sources. So this is an example of an actual WhatsApp message that I've received. So I don't have anybody in my phone called Bob. I've changed the name to anonymize, who shared it with me. But this is a common WhatsApp message that has been doing the rounds over 2020, just lying with saying how heat can kill the virus. If heat could kill the virus, it would mean that the virus would never exist in the summertime in pretty much any African country.
Yeah.
It's just too hot. It shouldn't be existing anywhere that's, you know, a few hundred miles north and south of the equator, anywhere around the planet. Like, shouldn't exist. But that's not true. You know, people are dying around the world. It's a horrible truth when this gets spread, because people are generally thinking that they have to keep on having hot liquids in order to kill the virus and all this other nonsense that's in here. Please, if you are getting any messages, anything that's telling you how to respond to COVID-19, make sure that the source is truth. Don't just make sure that the source is a parent, you know, friend, relative. That's not enough to know that it's true, because they might not even have known that it's true. Just a quick copy paste of some or most of, or if not all of the message into a Google search will tell you very quickly if that's a real message or fake. And other little underlying things is, well, is it actually telling you that, you know, such and such a doctor from such and such a hospital? There's so many times when this is all made up. So please be careful with some of these. Next then is looking at the importance of exercise. You know, even though you have to be socially distancing at the moment, it doesn't mean that you can't make time for exercise. And you want to reduce periods of idleness and be active daily. And when we're talking about daily, we really do mean every single day. And in context, you know, there's a lot of people, even myself included, who are working from home at the moment during this pandemic, which means there's a lot of opportunities for you to be actually quite idle and actually not moving enough. And because we're not commuting, it's very easy for us to work 9-10 hour days as opposed to the 7.5 day. And then even if you are having lunch, you're having lunch at your desk still, even though you're not in an office. This is quite bad because it means that you're just sitting down for too long a period. So this is some findings from the NHS advice that they provide, that actually you want to spend about 150 minutes a week doing some sort of exercise, not even brisk exercise. Brisk exercise, we're talking about water aerobics, could be just brisk walking, so walking, but it's a little bit faster than normal, riding a bike, dancing, it could be tennis, pushing your lawnmower, literally pushing a lawnmower, hiking, if you've got any mountainous or hilly terrain near you, going for a walk, rollerblading. Everybody can do brisk walking. Everybody can just walk a bit faster than they normally would, even if they've got slight mobility problems. It doesn't mean that if you are disabled and you're in a wheelchair that you can't still do some sort of movements with the limbs that you've got control over. It's really important. So next then is about having a balanced diet. Balanced diet to different people can mean different things, but whether you are vegan or omnivore and you eat anything, it doesn't matter. Still have a variety of fruit and vegetables. And if advised by your healthcare professional, by your family physician and the like, take supplements. There's ways you can be boosting your immunity by having a lot more fruit and vegetables in your diet, or even by taking any vitamins or minerals to support you. Take time to rest. And when we're talking about rest, it's about having enough sleep, but also breaks during the working day. It's very easy, again, as mentioned before, if you are always, if you're always doing things that's keeping you busy when otherwise you would have been commuting, which would have been a bit of exercise, whether you're driving or you're taking public transport. If you're always working, then when are the times to break? You've got to stop, take your time away from the computer, away from the phone, away from the desk, and actually go outside or walk around your house, walk around your home. Just take a break, just stop. The next area then. Use telehealth whenever possible. So this, sorry, I see that somebody's slide is not correct. But what I mean by using telehealth whenever possible is that when you're using telehealth solutions, you're able to still, most of the time, get a diagnosis from the clinician. So I'm not talking about going to speak to someone simply over the phone if you've got a knife in your back. That's not going to help you. You should go straight away to the hospital. If you've got signs and symptoms of COVID-19 and you're struggling to breathe, it means that you can't actually control yourself. Then these are times when you should be actually going out and seeking healthcare services. Well, telehealth is really powerful. As a doctor, most of the time, I have a good idea of what's going on with the patient just by talking to them. We follow up with investigations, x-rays, CT scans, blood tests, things like that, even a physical examination. But a lot of the information just comes through a conversation. And we found that actually where in some parts of the world, particularly in Europe and the US, there's times when telehealth was being used maybe less than 1% of all the consultations in community care with a GP. Now it can be 50% of all consultations is just done over the phone or with some sort of video conferencing platform. And it can be even more in other parts. So we really need to encourage people to continue doing this. And the next area then is looking at digital therapeutics. Now, digital therapeutic is any evidence-based digital product which prevents, treats, or manages disease. Now, these are really, really powerful ways of being able to provide care to people, even though they're not necessarily seeing a healthcare professional at that moment of time. So when we're talking about using digital therapeutics, it's a way of being able to dramatically reduce the amount of time you have to see a doctor in person, where you can actually, or not just a doctor, but it could be a physiotherapist, a nurse, specialist nurse. It's reducing time you have to see those healthcare professionals in person and manage health on your own. Now, we don't have loads of digital therapeutics on the market, or rather, to clarify that, we do have a lot of products on the market that claim to be digital therapeutics that don't have an evidence base. They aren't necessarily as reliable in providing treatment. But there are solutions out there, and it's important to just see what is your healthcare provider suggesting that you could be using. And that in combination with telehealth solutions can dramatically reduce the amount of times you have to come out of the house in order to see a healthcare professional. So the last one then is about following clear instructions, not just suggestions. And the big thing about that is the fact that there's a lot of times when people are actually following suggestions. It's implied that maybe it's an idea to wear a mask. Maybe it's, a good idea to stay at home. Maybe it's a good idea to perhaps work from home. Like, it shouldn't be suggested. You shouldn't have to think, is it a good idea or a bad idea? This is not useful advice. It needs to be clear. It's either you do something or you don't. When you have to actually make a decision on these things and have, because there's multiple choices, what if you made the wrong decision? And this is where we should be able to trust governments, trust politicians, trust the scientists to actually give us instructions rather than suggestions, so we just follow them. And the main reason for this is not because people are stupid. In fact, people can be very intelligent in being able to do what's best for them. But their opinions and their way of decision making is going to be governed primarily from their experiences, but also the experiences of other people around them and what other people around them tell them, but also people in positions of authority. What are they saying? And so a really wonderful point from the film Men in Black. Hopefully everyone's seen this film, and I'm not spoiling it for them, but there's a scene where Will Smith's character is explaining to his future partner, who is in the Men in Black, explaining that people are smart, they can handle it. And this is specifically talking about aliens, but I think you can definitely liken this to dealing with how best to respond in a pandemic and the virus. And as Tommy Lee Jones's character is saying, a person is smart, but people are dumb, panicky, dangerous animals, and you know it. And what I love about this scene, even though, again, it was talking about aliens, and I don't actually believe aliens exist. If others do, that's fine. But I personally don't think, I think this was all just fantasy. But anyway, if people are told stay at home, most of them will do so. This has been proven. If most people are told this virus is serious, most people are going to believe. If most people are told to wear masks, most people are going to wear masks. And if it becomes a law, if it becomes legislation, people are going to follow it. People follow instructions. You know, when it says, oh, there's a fire alarm, go to the exit with the green man and the green bar, green light, people will follow it because it's an instruction. People are less likely to be panicking and actually just go in the opposite direction. They're most likely to follow instructions when they're scared, when they're not sure what to do, when they're confused. This is why it's so important to have clear instructions. There's a massive human factors teaching here. The fact that when people are confused and you tell them to think, they're more likely to make wrong decisions because you're telling them to make a decision in a short period of time under duress, under stress. So it's not very helpful at all. So back over to you, Vineta.
Yeah, so we spoke about the 6 Ds and kind of the psychological response to COVID at the beginning of our talk. And I'm picking up on this again to look at, okay, how can we tackle these? And I really appreciate Dr. Zakriti's comment about they are kind of like stages of grief, really. And that's kind of what I was leaning on, the stages of grief, but also fight, flight, fear responses, flee responses, and looking at actually what out of them comes together, particularly for this pandemic. And so for all these 6, so we spoke about the dissociated, we spoke about the determined, we spoke about the destructive, the distressed, the depressed, the doer. All of these, the basis of good mental health is good health in all areas of your life. So the points that Giles made about maintaining good health during COVID-19 are so important for also our mental health. But then it also takes it further with actually self-care and self-compassion are key to our mental health being maintained in this time. So self-care looks at looking after your body, looking after your mind, your soul, making sure that your basic needs are met. And as Giles touched on, the healthy diet, the exercise, and I know Paul mentioned about, gyms not closing. But there's also obviously the option of joining online classes. There's so many new formats of going to the gym that have come up in this time and in this season. Like I said, it might look different in this season because you might have to do the online gym or you might have to meet friends over Skype or whatever else. But look at how you can maintain self-care. And self-compassion talks about just being kinder to yourself, being more patient with yourself, and also extending that towards others. So as we look at the first element then, so it's the dissociated, the people who, remember I mentioned, are pretty numb and overwhelmed. They're not able to make decisions at the moment. It's looking at using medical specialists, counseling and mindfulness techniques to help them in this time. dissociation to a certain extent is a natural response to trauma and to anything that we cannot control. However, if you've already got a clinical diagnosis of a dissociative disorder, then obviously in the first instance, speak to your GP or mental health care provider. And if you have recently started feeling like this because of the pandemic, then and it's becoming more and more regular, then of course, again, get in touch with your GP or mental health care provider to have a conversation with them. But what really helps in this time is mindfulness activities, bringing you back into the here and now, helping you focus your attention, because there's so much going on in the world right now that it's easy to just back away and just be numb to it all. But mindfulness really helps. Something practical like journaling or taking notes helps to remember things, because memory and confusion can be quite high in this time as well. Minimize your intake of COVID-related information where possible, especially the fake versions, but look at how you can potentially obviously make sure that you stay up to date with what's relevant for you and your region on a daily basis, but maybe only tune into the news, COVID-related news, once a day rather than every 10 minutes, because that's not really helpful. And then the next one is looking at the distressed. And this is looking at focusing on grounding techniques and taking control, focusing on what you actually can control. Again, anxiety is a natural response to trauma. However, once again, if you already have a clinical diagnosis of an anxiety disorder, then speak to your GP or mental health provider if you feel like symptoms are getting worse, if you feel like you're running out of medication, if you've recently started feeling like really anxious on a consistent level, then again, speak to your mental health care provider or your GP to look at how they can maybe support. But some of the self-help things that can work is looking at grounding techniques. In counseling, we talk about grounding techniques in dealing with anxiety. And that is pretty much, again, things that can pull you from the vicious cycle of what if the worst happens? What if the worst happens? Let me worry about everything that I can't do anything about. It's to help anchor you into the here and now and look at actually what are you able to do? And things like meditation apps work really well. Counseling works really well. Remind yourself of what you can control. One of the things I wanted to mention here is obviously the big debate at the moment is the whole, is Christmas going to be digital or not? As in, are we going to be able to be face-to-face with family members from different households, or will it have to be another Zoom meeting? And one of the things I would say is actually ask yourself, what's the worst that could happen? You know, the governments, I feel like they don't know, or they don't want to panic us. You know, they're hedging their bets. They're looking at how measures that they're putting in place now are going to affect December, Christmas, winter, you know, and so for ourselves, anxiety flourishes when there's no clarity. It flourishes when there's no instructions, like Giles was saying. So what we need to do for ourselves is give ourselves those instructions by asking the question, okay, if the worst would happen and, you know, there's a complete lockdown again and there's no mixing of households or whatever else it might look like for you, what's the worst that could happen for you? That's the answer. That's the question you need to ask yourself. Make it clear, write it down. What is the worst case scenario for you that could happen? And then look at, you need to take it further. You can't stay there. Look at, okay, what can I do that's in my control in this situation? So again, bringing the example of Christmas, because I know that's something that is spoken about a lot. How can I make sure that a digital Christmas can be as meaningful and as connected as well, it might not be exactly the same, but how can I make sure that it is meaningful, that it is connected? You know, how can we explore things? And that's something that I'm really passionate about helping people doing as a counselor, but also as a coach, going from yes, emotions are heavy, and we need to give space for the emotion and the loss of maybe not being able to see family members around the time that you want to. But let's look at also solutions. What are the things that we can actually do for ourselves to make this better? Moving on to the destructive. If you're a victim of domestic violence, we urge you to contact the relevant support helplines in your country, or call the police. And you know, you can find the numbers for those helplines by Googling them or searching them on the internet. It's not acceptable for someone to be violent towards you, and it's not acceptable for you to be violent towards anybody else. Just to make that very clear, it doesn't matter how unprecedented these times are, how distressing these times are, this is not acceptable behavior, and you should get the support that you require. The same goes if you or someone you know is having suicidal thoughts or is self-harming. Please seek your local suicide prevention helplines. Please call the police if you are with someone who's wanting to commit suicide. And again, it's helpful to see a counselor or a therapist at this time to work through any anger potentially that's at the bottom of this destructive behavior in a safe way, by identifying the goals that are being blocked, but also helping you process the grief and loss that is happening, because so much is not happening in this time. So for the depressed, it's about, again, speaking to medical specialists, counselors, using self-help guides, exercises. Again, if you've already got a diagnosis of depression, then it's speaking with your GP, and you feel like things are getting worse, speak to your GP, speak to your mental health care provider. If you started feeling like this, speak to your GP, speak to your mental health care provider. And again, it's also really useful here potentially to try out counseling, so you have more time to just explore how you feel, because sometimes we just need someone to sit with us and listen, and counseling can really help with that. And other options, like you said, is exercise, meditation, mindfulness activities. So for the determined, this is where people are very motivated, but the issue is that you could have all the motivation, but none of the successful mindset or methodologies to make your plans come to pass. And so here, coaching can help so well, and productivity tools, but also counseling can help really well, because we're trying to get from this place of imperfect action being better than perfect inaction. It's better for us to be doing something than just not doing anything. And one of the things that I'm very passionate about talking about is imposter syndrome, this persistent feeling of self-doubt. And I feel like imposter syndrome, I need to do the study, but I feel like imposter syndrome has skyrocketed this year because there's so many things that we doubt that we can do for ourselves in this year, in this very oncoming year. And it's a very big mindset blocker. So you might be so motivated to get a million things done, but if you have imposter syndrome, if you're struggling with self-doubt, it can be really hard to take the next step to do what you need to do. And I'm actually offering a course on overcoming imposter syndrome next weekend. So feel free to get in touch with me to find out more information. But it's in the determined stage, it's looking at developing SMART goals. It's making sure that you are doing things that are also connected to your purpose. And the final element of the doer, which, you know, Damien has mentioned, well, we're all in some way in the doer category because we are on this webinar. It's, again, utilizing coaching, but potentially also counseling and productivity, because the danger with being a doer is that you could be hiding emotions behind your actions. Yeah. But the danger is also, like Giles was saying, burnout. If we are just going, we can, and we probably will burn out without a break. And it's about getting you away from just doing for the sake of doing, which also ends up wasting loads of time. So speaking to a coach, speaking to a counselor is really helpful here. I know everyone loves like stories of transformation, the like grand before and afters of like makeover shows, you know, but the fact of the matter for us is we need to make sure that we're not sacrificing our authenticity. We're not sacrificing our purpose. We're not sacrificing our authentic and intimate relationships for the sake of applause of followers, just so that they can see, oh, 2020 was the year of COVID-19, but in 2020, I bought my house and I renovated it and I built a business and I lost 20 pounds. And that's all great. But what is it that you should be doing that will actually feed your soul, feed your relationships, feed your mental health, and also propel you further towards your purpose? So again, it's about SMART goals. It's about making sure that you do self-care, you engage in self-care consistently.
Yeah. So that's all for now then for us.
Yes.
Thanks a lot for listening. Please do stay in touch. These are contact details that you can use to reach out to both Vanetta and myself. And I think it's been a real pleasure actually spending some time. We didn't actually introduce ourselves very much at the beginning of the session, but it's probably implied by us having the same surname is that we're not actually brother and sister, we're husband and wife. That's why we've got the shared surname. So but yeah, please do stay in touch if you feel that this talk has been useful to you. I know some of you may have reached this because of being a member of the CUXA and on the mailing list, or otherwise you found us through LinkedIn. But however you found it, please do reach out to us if you've got any further questions or comments that you would like to share. And we're going to be here for another 5 minutes or so. So if there are any questions, please do write them down in the comments, because this topic is really big one for us. You know, we're all in the pandemic for considerable more time, I would say. It's very difficult to know when this pandemic is actually going to end. As of this recording, we're at the end of October. It's Halloween, actually officially today. And we don't really have any expectations that the pandemic is going to be over before
anytime
Christmas.
soon. And again, so for us, it's and I don't know if you want to think about actually which one of the 6 do you feel most resonates with you at the moment. But for me, it's not about doom and gloom. It's not about doom and gloom at all. But especially for myself, who's personally quite a planner, like I said, anxiety is bred in confusion. So for me, it's very much looking at, okay, so what can I do? What can I do? If Christmas is digital, if we're away from family, friends, whatever, how can we still make it special? You know, and for us, we are discussing that now and looking at what's important to us. You know, what can we do to make this space that we have moved into, that we have emigrated to, feel more like home? You know, and I use Christmas as an example. I know not everybody celebrates Christmas. It's just one that is very emotive. If you do, it's very emotive. But there might be other things that this winter you were really looking forward to that are not happening. And it's encouraging you to look at, okay, what is it that you can do that will help manage this uncertainty?
I think for me, the best way for me to manage the uncertainty is actually focus on, well, what am I working towards? What goals do I have? You know, there's a lot of plans that I have. In the short term and long term. It's by keeping those at the back of my mind and sometimes bringing it to the front of my mind that can give me the plans and the next steps to actually move forward and be optimistic during this pandemic. Because it's actually quite scary at times. Because you never know when something could be quite serious, either to yourself or a loved one or anybody else that's around you in the neighborhood. You know, we do live around quite a lot of people who are quite elderly here where we're living in Germany. And it would be devastating to know that one of them was to get the virus, they go into hospital, and they don't come out alive again. You know, so and this is the reality of the times that we live in. And we know that death is a normal part of life. People were dying before the pandemic came, but it's definitely hastening people's deaths at the moment. It's really sad.
And one of my favorite quotes by Daniel Goleman, who's like the pioneer of emotional intelligence, if you've heard of that concept before, is leaders guide attention. And I've quoted this ad infinitum this year because I'm like, this is the year where leaders really show their mettle as such, you know, where we truly see who is able to guide with dignity, with integrity, with clarity, and who isn't, or who is struggling, or who has competing agendas. Like we said, you know, sometimes it's not as easy as we think it is. But yeah, so maybe for yourself, ask yourself as a leader of at least yourself, if you're a parent, if you're a partner, if you are, you know, have your own business, there's also many other areas that you're a leader in, but we all should be at least a leader of ourselves. How can you guide your attention in this time?
That's it. So, any parting words that you want to offer, Vanetta, before we leave?
I think for me, it's just being grateful to have what I have in this season. Like gratitude has a massive impact on my perspective of COVID. So I have a chronic illness, which puts me in that vulnerable category, and has meant that I've had periods where I was a bit dissociated, where I was a bit distressed because I just thought to myself, I can't go out, you know, and maybe someone who was dodging health-seeking behaviors. But one thing that I've been reminded of more so this year is to be grateful for what I do have, to focus on what I do have for now.
No, I think that's really good advice because, you know, for me, you know, we have work opportunities, we can, you know, provide for ourselves. You know, we've got a roof over our head. We're able to actually have a really wonderful life. These are simple blessings that a lot of people can't even say that they have. So even separate to the pandemic, it's important to be grateful in life.
Yeah, exactly.
But even more so now with the pandemic, how a lot of people have been rendered homeless, they've lost their jobs. It is really important to be thankful of what you have,
Mm-hmm.
and to try and use your resources wisely. I think the other big thing for me, which builds on that, is the fact that with the pandemic killing people, but also this sort of long COVID symptoms, which is very similar to what we call fibromyalgia. So a lot of fatigue, general tiredness, muscle weakness, just generally finding it difficult to function throughout the day. There's a lot of people that are suffering from this sort of condition as well. And health is your greatest wealth. Like, how are you supposed to do your job if you're sick? How are you supposed to look after your spouse if you're sick? How are you supposed to look after anybody who's dependent on you if you're sick? Great health is great wealth.
Yeah.
It is what allows you to be able to do the many things that you want to do in life. And so I do keep in mind, what am I actually doing to keep myself healthy as a husband, as a son, as a brother, as an employee, as someone who, has friends, who is neighbor to people. You need to do what's necessary to keep yourself healthy. Otherwise, how are you going to be able to contribute to the world and the people around you? So I think that's probably my part in wealth is,
health is wealth.
Health is wealth.
Health is wealth. Yeah.
Sure. So I'm not sure if there's any other questions, or we'll probably wrap up here. But thanks again for joining us.
Thank you.
It's been a real pleasure being able to talk about this topic. It's a real passion of mine. Clinical UX is something that I teach quite a lot. I've even got quite a few students who are taking the clinical UX course. So this is a 12-month part-time course that people study over the weekend, allowing them to still have time for job or job seeking or any other activities that they might be doing in the working week. And they can focus on learning about clinical user experience in order to change careers or apply what they've learned to their day job, or to just be more active in the digital health and healthcare service design scene. So if this is something that you're interested in yourself, please do reach out to me. You can just email me at Giles, Gyles, @clinicalux.org, or visit clinicalux.org as a website to find out more information about the course and what the Clinical UX Association does in general. And the CUXA, for short, Clinical UX Association, is the world's leading authority on clinical UX. And we do a lot of teaching and training, but also workshops, events just like this webinar, so that people can learn more about the importance of user experience in healthcare, providing better tools and technologies and services for clinicians to do their job, but also better products and services for patients and the general public so that they can stay healthy. So if you're keen to learn more, please do reach out, like I said, clinicalux.org. And for you, Vanessa, how can people stay in touch with you?
So people can stay in touch through my website, blueprintway.com. So like I mentioned, I'm a counselor, I'm a coach, but I particularly talk about the concepts of emotional wealth. So even when we don't necessarily have physical health, there is a way to live our best lives in this time, and also imposter syndrome, how to overcome imposter syndrome. So blueprintway.com, and feel free to email me, vanetta@blueprintway.com.
Yeah. So again, thank you for joining us. It's been a real pleasure talking about this wonderful topic. I know some of it can be a little bit dark and a bit sad, hearing about the deaths, hearing about some of the failings that we're facing, some of the issues that we're facing with leaders, with bad advice that's been shared. But there are definitely a variety of products and services out there that can keep you healthy, that can keep you safe. So thanks again for joining us, and please tune in to the next webinar from the CUXA. Bye for now.
Bye.